friends. This is Dr. Rajendra Kumar from Coimbatore. I'm a consultant physician as well as a diabetologist for a past 15 to 15 plus years. I am having a diabetes center at Singanallur. Today, the main topic is the hypertension. What is hypertension mean? The blood pressure of the individual above the normal is called hypertension. The normal is 140/90 is a maximum normal. Below this only the correct tension. The hypertension can be because of due to the one is a familial. Family means the family, grandfather, grandmother, and mother and son and son-in-law. So the families are coming. Second is the reason. It is secondary to some of the aldosterone mechanism, endocrine mechanism, or some disease or defect may be there. Third is the main cause for the unknown etiology, idiopathic hypertension. This only comes for 95% of the people. 95% of people comes under the unknown or the idiopathic pathology. Actual reason is still we don't know. That is the reason. But the recording of the blood pressure is high, very high. So that will lead to the vascular damage and the endocrine damage are there. For that only, we have to protect and identify, and we have to rectify the hypertension. So, if the what could be happen if the hypertension is not controlled? That will lead to in brain, that will affect. One is a brain, that will form a stroke. Second is a heart. Heart will have a heart attack. Third is a kidney. Kidney will have the hypertension effect and end stage renal failure. Fourth is any organ, muscles and all those things. Eye also having the very peculiar to this thing. The main thing is brain, heart, kidney, and eyes are the vulnerable for the long-term hypertension. So that only we have to identify and we have to correct the hypertension. Okay, now. So in order to identify, we have to check in the mid-arm. Right arm, we have to check the blood pressure. If preferably above the 35 years of age, or in a sedentary peoples, like physically lesser peoples, IT peoples, these are all the peoples are all less physical activity they will have. So those peoples are all more vulnerable for the hypertension. So the reason we sorted out. Then the management. Management consists of, first is a diet, second is a physical exercise, or LSM is a lifestyle modification. Third only the diet. Third only drugs. So first is a diet. In diet, usually now salt restricted diet is advisable, because salt is very much essential for the body cells or the tissues to function. So we require salt, but the maximum of 5 grams per day is allowed. No excessive salt should be there. So the first thing is restricted salt. 5 grams salt per day is allowed. Second is avoid the pickles and peppers and all those things, hyper salt, we have to avoid. Second is the physical exercise. Any form of physical exercise is very good. First is regular walking. Second is yoga or cycling or gardening, whatever may be, the physical exercise should be 30 to 40 minutes per day, at least 5 to 6 days per week is recommended to have a good stamina and good circulation. Third one is the drugs. Drugs means now, drugs means if the starting 150 to 150 systolic and 100 diastolic in a individual having 30s now, this will be controlled very well with the diet and physical exercise alone. If the what is the thing means now, most people have a stress and a sleeplessness pattern. So we have to avoid or come down the stress factors, and we have to sleep for at least 6 to 7 hours per day, 10 p.m. to 6 a.m. night. We have to sleep to create a circadian rhythm control. So the sleep factor is very much important. Same time, then the oil factor. We should take only uh, 3 teaspoonful. That is 15 ml of oil per day. It comes around 450 ml of oil per month per person per family. So roughly around a half a liter of oil is allowed for the uh, per month schedule. So if you take excess oil also, that will form a fat deposition, hyper fat deposition in the body and as well as the liver, that will create the hypercholesterolemia. So that also a very good factor for accelerating the hypertension. Then the smoking is there. Smoking is a one of the main reason to increase the blood pressure, and the alcohol indirectly increases the cholesterol level, so that will increase the hypertension. Then the hypersalt we discussed as earlier. Then the some drugs, some catecholamines or the steroids, that will produce the hypertension. So, in order to avoid the complication, we will check through a proper health checkup and find out the cause for hypertension. If it is secondary to some drugs or some physical inexercise or anything like that, obesity also this also a risk factor for hypertension. So we have to, if possible, we have to find out the secondary cause for producing hypertension. If it is not there, means now we have to first we have to maintain a correct BMI. BMI means body mass index. We should correct. Then increase the physical activity. Then decrease the salt intake as well as the fat intake also. So this will reduce nearly a 50 to 70% of people. This itself will control the blood pressure and the sleep pattern. Sleep pattern also a important one. This also helps to reduce the stress level as well as the steroid levels in the body. Then if it is not controlled with these measures, we can go for pharmacological methods. Pharmacological methods are having a first line of beta blockers, second line of calcium channel blockers, or telmisartans, or the combinations are there. Depends upon the patient's mindset, physical activity, and the body condition and other drug interaction. Doctor will contribute or suggest a better drug for a hypertension. So whatever may be, you first thing is to regulate the or bring down to BMI under the main factor for hypertension is a overweight or obesity. So you bring down the body weight to the standard level. Then we have to raise the physical activity or physical exercise. Then decrease the salt and decrease the fat intake. This will give you a maximum control and the sleep. So if it is not controlled with these measures, we can go for a pharmacological methods. This is the basic method of controlling diabetes. It is, if it is required, we can have a 24-hour ambulatory control also. We will request them to for a check for a ambulatory monitor for 24 hours, whether this patient is a level hypertension or the sleep oriented or the stress oriented. We can have by the monitoring the blood pressure. Okay, whatever may be, we have to require regular and continuous follow as well as the modification of lifestyle modification, and the drugs also should be modified or initiated as much as possible, as soon as possible. Okay, thank you. Any queries can be contacted to me. Thank you so much.